Welcome to this third part in our series on how to interpret knee X-rays. In part 1 we discussed the knee X-ray from the front, that's the AP view, and in part 2 we discussed the knee X-ray from the side, that is the lateral view. In this particular part we're going to talk about a special view called the Skyline view. It's called a Skyline view because when it's taken properly, you can see the kneecap or patella apparently hanging on the skyline above the horizon of the femur bone. I've outlined it for you here so that you can appreciate what I mean. This particular angle gives a great view of the patella, and that's what it's mainly ordered for. To obtain a skyline view requires some special positioning. The X-ray beam passes down from above the patella at a particular angle so that the patella is clearly differentiated from the groove of the femur underneath it, and the patella is captured in profile from this position. Here's a drawing to show you exactly what I'm meaning, and an X-ray to allow you to compare to the drawing. The groove of the femur underneath the patella is called the trochlear groove. And it's important to look at the congruency of the contact surfaces here. Nice congruent surfaces suggest that this patellofemoral joint is likely to be healthy. From the skyline view, one can clearly see the shape of the patella, whether it or its underlying trochlear groove of the femur are abnormal or not. Abnormalities in the shape of the patella or trochlear, if one's born this way, may be due to the conditions known as patellar dysplasia or trochlear dysplasia. From a skyline view, one can see whether the patella tracks over too far to one or other side, which is called maltracking, or whether it is tilted abnormally on its edge, which is called patellar tilt. Of course, you need to appreciate that these are static views as the patient's lying still, and when the patient's actually moving, these might not be absolutely the same, but it does give an indication of potential problems in these respects. Take a look at the pale articular cartilage seen here. Articular cartilage is radiolucent and is generally not very evident on X-rays, but it can sometimes be seen quite nicely in this view when the X-ray beam is softer. The skyline view may also reveal bone breaks or arthritis. A fracture or bone break of either the patella or trochlear will show up as a dark line. Arthritic changes may reveal themselves as small bubbles of cystic alteration in the bony surface, or irregular spurs at the joint edges. There's so very much useful information that you can glean from a skyline view that it's very strange that it's so often left off the order. Knee surgeons in general would order at least these 3 views, and many would order as a routine the 4th view that we're going to discuss in part 4. Take a look again at the 3 ways we've seen so far to appreciate the patella, via the AP view, the lateral view, and the skyline view. It's very clear that the latter 2 give loads more information about the patella compared to the first view. And also clear that the skyline view gives information about the trochlear not at all evident in either AP or lateral. Well, that's the end of this part. This particular presentation is only short, but nonetheless, the skyline view is really important. Thank you for listening, and please remember to subscribe to our YouTube channel.